to light the way. Making nursing stupid simple every day.
Hey, welcome back. Today we're covering one of the most important things you'll ever learn as a nurse, the ABCs. Airway, breathing, circulation. This isn't just something you memorize. This is how you think when a patient is in trouble. Let's get into it. Airway is always first. Always. The airway is the path from the mouth and nose down to the lungs. If that path is blocked, nothing else matters. Your patient cannot breathe, and if they can't breathe, they can't live. Signs of airway trouble? Listen for stridor, that loud crowing noise. Gurgling, no air movement. A patient who can't speak. Those are red flags. Act fast. Airway is open. Now ask, is air actually moving? A patient can have an open airway and still not be breathing well. Think about a patient who overdosed. Airway clear, but only 4 shallow breaths a minute. That's a breathing emergency. Watch for low SpO2, a respiratory rate that's too slow or too fast. Nasal flaring, accessory muscle use, or cyanosis. Rate and quality both matter. Airway open, breathing adequate. Now, is blood getting where it needs to go? When circulation fails, organs start shutting down fast. Your patient becomes restless, confused. Blood pressure drops. Heart rate climbs. Skin goes cool, pale, and clammy. That's shock. The brain is telling you it's not getting enough blood. This is a circulation emergency. Don't wait. Here's how to think on the floor. Unstable beats stable. Acute beats chronic. Unexpected beats expected. A COPD patient with SpO2 of 90% who is always at 90%, that's their normal. That's expected. A post-op patient who suddenly drops to 88% and becomes confused, that's unexpected. That's your priority. And remember, a patient who is speaking to you has a patent airway and is breathing. Now assess quality. Here's what new nurses get wrong. They go to pain first. Pain is important, but a patient with pain who is stable does not come before a patient who is not breathing well. Hypoxia kills in minutes. Pain does not. Airway, breathing, circulation. In that order. Every patient, every time. Unstable before stable. Acute before chronic. Unexpected before expected. Stupid simple. See you in the next lesson.
Okay, let's bring it together. The ABCs aren't just a memorization trick. They're a thinking framework. Every single time you walk into a room and something feels off, start at A and work your way down. Here's what I want you to actually remember from this lesson. First, airway problems kill fast. Stridor, gurgling, silence. Any of those sounds? You stop what you're doing, right now. Second, breathing and airway are not the same thing. A patient can have an open airway and still be failing. Watch the effort. Watch the rate. Watch the SpO2 trend, not just one number. Third, circulation failure sneaks up on you. By the time the blood pressure crashes, the body has already been compensating for a while. Restlessness, confusion, cool, clammy skin. Those are your early warnings. Don't wait for the number to confirm what the patient is already telling you. And the one thing that trips up new nurses the most? Assuming confusion is behavioral. New agitation, new restlessness, new confusion, always check the ABCs first, every time. All right, NCLEX question. One shot, think it through. A nurse is caring for 4 patients. Which patient should be assessed first? A COPD patient with an SpO2 of 90%, which matches their documented baseline. B, a post-op patient who is suddenly confused and restless 2 hours after surgery. C, a diabetic patient whose blood glucose is stable at 210. D, a patient who is awake and requesting pain medication, rating their pain a 6 out of 10. Pause. Think like a nurse. Which one? The answer is B. Here's why. The post-op patient with sudden confusion and restlessness is showing an unexpected acute change. That is your red flag. After surgery, new confusion can mean hypoxia, internal bleeding, or dropping perfusion. You don't know which yet, but you need to find out immediately. Now let's talk about the others, because this is where NCLEX tries to trick you. Option A, the COPD patient at 90% SpO2. That sounds alarming, but it's their documented baseline. That's an expected finding. Expected findings are lower priority than unexpected ones. Option C, stable blood glucose at 210. Not ideal, but stable. Not a crisis. Option D, pain at 6 out of 10. Important. Not an emergency. A patient who is awake and describing their pain has a patent airway, is breathing, and is alert enough to communicate. The ABCs are intact. The pattern? Unexpected beats expected. Acute beats chronic. Unstable beats stable. Every time. All right, future nurses. So how did you do with today's lesson? If you felt stuck on a topic, don't stress. That's how you learn. Nursing school is all about repetition, practice, and building confidence one step at a time. Don't forget to grab your free cheat sheet linked below to help you review today's lesson. And if you want extra NCLEX-style practice questions, bonus rationales, memory tricks, and extended study sessions, check out my Patreon linked in the description for even more no BS nursing content. Make sure you like, subscribe, and turn on notifications so you never miss another stupid simple lesson. All right, future nurses, you've got this, and I'll see you in the next one.